Hi, everyone. Welcome to our webinar. We will give it about another minute before we get started to allow more people to enter the webinar. So sit tight, please. Okay, why don't we go ahead and get started? I want to leave as much time as we can for presenters and for Q&A. So hello, everyone. Thank you for joining the American Lung Association today for our webcast on the impactful strategies for radon in state cancer control plans. This is the second in a series of webcasts the Lung Association is holding on the findings from our analyses of state cancer plans. The next one will be on outdoor air and state cancer plans sometime later this summer with the date to be determined. And we can certainly keep you posted on that. A reminder that today's webcast will be recorded and we'll send you a link to the recording that you can revisit or share after the webinar. My name is Catherine Pruitt. I'm the Senior Director of Nationwide Clean Air Policy with the American Lung Association. Joining me as presenters are Katie Jones, Program Manager with the Iowa Comprehensive Cancer Control Program at the Iowa Department of Health and Human Services, Rachel Schramm, Program Manager with the Iowa Cancer Consortium, and Alexis Gigliello, Manager of Nationwide Health Promotions at the American Lung Association. Before we get started, I should note that we're aware, of course, that the National Comprehensive Cancer Control Program at CDC is slated for elimination in the President's fiscal year 2026 budget, along with most of the rest of the Chronic Disease Center. However, while our advocacy colleagues are hard at work to protect and keep the program, our work to reduce the burden of cancer is continuing. And we're pleased to present this information to you all in the meantime, in the hopes that it will be helpful moving forward your cancer control work as well. Next slide, please. Our agenda for today's call is a refresher on radon basics, the national landscape of state plans, introducing evidence-based interventions, radon in the Iowa Cancer Control Plan, Lung Association resources and initiatives that you might find useful, and a Q&A at the end. If you have questions for the presenters as we go along, please put them in the Q&A box, and we'll get to as many of them as we can at the end. Next slide, please. Let me take a few minutes to review some radon basics for those of you who may be less familiar with the issue. Radon is one of the most widespread and harmful environmental health hazards that many people know nothing about. It's a naturally occurring radioactive gas that originates in rocks and soil containing uranium, which is more common than you might think. It's undetectable by our senses, invisible, colorless, and odorless. It's found nearly everywhere on Earth, though at higher levels in some places than others, depending on the underlying geology. Next slide. So why do we care about radon? The US EPA has estimated that radon causes about 21,000 lung cancer deaths per year. That makes it the second leading cause of lung cancer after tobacco use and the primary cause in people without a smoking history. And that's why we're talking about it today. Reducing exposure to radon is an important lung cancer prevention strategy. Next slide. The structure of the lungs explains how radon causes lung cancer. First, almost all radon is breathed in and breathed out again without causing any harm. But as that radioactive radon gas decays in the air over the course of a few days, it releases atoms called decay products. You can inhale those decay products, which can get deposited on airway tissues. Unfortunately, in most cases, your lungs can't clear them out before they decay again, releasing radiation that damages the DNA and the epithelial cells that line the airways in the lungs. It's that DNA damage that can sometimes result in lung cancer. Next slide. The National Radon Action Plan, or NRAP for short, serves as a framework to guide nationwide action to eliminate preventable lung cancer from radon in the U.S. by expanding protections for all communities and buildings. It was developed through a consensus process by a diverse stakeholder group with representation from federal agencies led by EPA, nonprofits, including the Lung Association, and professional membership organizations. First released in 2015, the National Radon Action Plan is now in the last year of its second edition. The NRAP is organized around 4 goal areas, each of which lays out some key strategies and outcomes that the stakeholder group has agreed are impactful and feasible approaches to reducing radon risk. Next slide. One of the strategies in the National Radon Action Plan is to support state cancer control programs to include radon indicators and interventions with the desired outcome that all state cancer control programs include radon risk reduction interventions in their primary prevention strategies for lung cancer. Here's a list of the current landscape of radon in state cancer plans. 36 states include some mention of radon in their plans. 30 of them, seen here in pink, include some specific action-oriented strategies. The 6 states in green include a general mention of radon as a risk factor for lung cancer, but no control strategies. And the 14 states plus DC in gray do not mention radon at all. Next slide. So the Lung Association analyzed the 30 state plans that include actionable strategies, and we're able to categorize those strategies into 10 general themes. They are testing, mitigation, building codes and or radon-resistant new construction, funding, a catch-all category for policy change, schools and or daycare facilities, reaching real estate professionals, reaching healthcare professionals, connecting tobacco and radon awareness, and reaching under-resourced communities. With the exception of the catch-all policy theme, all of these strategies are aligned with priorities included in the National Radon Action Plan and are approaches that the radon community strongly supports. Next slide. We've mapped a couple of the most widely adopted strategies to give you a better idea of the landscape, and I've pulled out some sample language from the plans as examples. As you can see from this map of radon testing strategies, all 30 of the states that include any strategies include testing, which is great. And most of them also include mitigation, which is even better. Florida, for example, which should be blue on this map, sorry about that, has a detailed strategy to support the development and implementation of systems changes that increase the number of buildings tested for radon level and facilitate radon mitigation when radon levels exceed the EPA action level. This strategy is tied in the plan to measurable objectives to increase the number of homes measured for radon by 7% annually and to increase the number of homes mitigated for radon by 5% annually. Minnesota takes a different approach to develop partnerships that will promote and increase testing and mitigation in residential properties and other buildings. Next slide. Half of 30 cancer control plans include detailed strategies. Um, with detailed strategies include at least one strategy on building codes and/or radon-resistant new construction techniques. In Colorado, the plan seeks to educate builders, code officials, city councils, and county commissioners on the hazards of radon exposure and the importance of adopting radon-resistant new construction building codes. In Nevada, the plan is to promote policies for radon-resistant homes, including radon-resistant new construction and licensure for radon professionals. Next slide. And 18 of the cancer control plans with detailed strategies include a strategy pertaining to protecting schools and/or daycare facilities. Illinois already has a strong schools testing policy in place, and the cancer plan has included a strategy to support implementation. It reads, promote the school radon testing program established by the Illinois Emergency Management Agency with a stated objective to increase the number of Illinois schools tested for radon from 89 to 200 by the year 2027. Kentucky's strategy is to establish incentives for schools, daycare centers, and workplaces to test for radon. Next slide. So for cancer control coalitions and radon advocates that are interested in adding or strengthening radon risk reduction strategies in your state plans, and we hope it's most of you, the National Radon Action Plan Leadership Council has created a menu of evidence-based interventions that are outcome-oriented and aligned with nationwide priorities. We believe that the more we can all row in the same direction, advancing similar strategies, the more we'll be able to learn from each other and accelerate the pace of change. Next slide. There are 18 evidence-based interventions on the menu, each of which is associated with one of the 4 NRAP goal areas and a measurable indicator. I've pulled out a few here on this slide to give you an idea of what they're like. Let's see, I want to read a couple of them for you. In goal area number 1, for example, we have a measurable indicator of the number of laws and policies requiring radon notification, health risk warning statements, and radon test result disclosures in real estate sales and rental transactions. And the evidence-based intervention that we're proposing is appropriate for cancer plans is to promote laws and policies that require radon notification, warning statements, and disclosure during real estate sales and rental transactions. In goal area number 2, which is to support radon risk reduction, one of the indicators is the number of state and local home rehabilitation and repair programs that include radon mitigation among their services. And the evidence-based intervention for a state plan would be to provide grants or loans to community-based organizations providing low-cost, no-cost radon mitigation in low-wealth communities. I'll stop there. And remember, if you have any questions, please post them in the Q&A box. And next up are Katie and Rachel to tell you more, to tell you about their work together on the Iowa Cancer Control Plan. Thank you.
Hi, thank you so much for having me. I'm Katie Jones. I'm the program manager of the Iowa Comprehensive Cancer Control Program at the Iowa Department of Health and Human Services. And Rachel Schramm is here too, the program manager of the Iowa Cancer Consortium. We're going to be working together on this presentation. And so we can go ahead and go to the next slide. So first, I just wanted to have one slide that's Iowa specific with Iowa specific cancer data. This is just to show that Iowa has very high cancer incidence rate. We have the second highest rate of new cancers in the US, and that's age adjusted. And there's been a lot of interest in why, and we've expanded our partnerships recently due to this urgent issue. Our rate is also one of the few that's increasing. And our Iowa Cancer Registry, we work a lot with, and they've dug into this more. And lung cancer is one of 4 cancers they've identified that's helping to drive this trend in Iowa. Next slide. So, as I said before, I'm the program manager of the Iowa Comprehensive Cancer Control Program. And as I'm sure many of you know on this call, the comprehensive cancer control programs have a lot to do with the whole cancer continuum, from preventing cancer whenever possible to increasing cancer screening to supporting cancer survivors. And it's very focused on collaboration and supporting a cancer coalition. And for us in Iowa, we are so fortunate to have the Iowa Cancer Consortium, which is a nonprofit organization serving as our cancer coalition. And now I'm going to transition it over to Rachel for the next few slides.
All right, if we can go to the next slide. Thanks, Katie. Yep. So my name is Rachel Schramm. I'm a program manager here at the Iowa Cancer Consortium. And just wanted to share a little bit about our organization so you can get a feel for that. But we serve as a nonprofit organization and really have the intention to bring people together to work on cancer control issues and make cancer less of a burden in our state. It is our mission to advance cancer prevention and control in Iowa through advocacy, equity, and collaboration. So what you can see on the screen is kind of our organizational chart, but we do serve the entire state of Iowa and have approximately 700 members who all come together with a range of different lived experiences and educational backgrounds to really reduce the burden of cancer in our state. You can see we have an active board of directors. We have both individual and organizational membership levels, and then a variety of work groups and committees that our members can participate in. Of course, all virtually and dependent on like what they're interested in. These work groups are really a direct reflection of what our membership considers as key issues, which is identified in our cancer plan. And I'll share more about that in the coming slides. But our Radon work group is, I feel like, one of the longest standing work groups that we have, and is a very passionate and dedicated crew. So I'm excited to share a little bit of their work. And of course, we are a small but mighty staff listed there on the right-hand side. We would not be able to do this work without our staff, and hopefully the funding continues. This is a little outdated. We've lost our PGAP on Valentine's Day this year, but it's hard work right now. Cancer control is really hard work, but we're happy to be together and presenting this information. Next slide, please. All right, so as Katie mentioned, we receive a portion of our funding from the federal government through Katie's organization, Iowa HHS. But that money flows through the CDC's Comprehensive Cancer Control Program. And as part of that funding, every state is required to have a cancer control plan or blueprint that covers how to address cancer rates in their community. So it's really a document that we believe represents that shared vision for our coalition, and has been really key in building not only like policy and educational momentum, but also just keeping a lot of the energy around all the different cancer control issues that impact our folks. So, and we do have a specific section on radon that I'll talk about. I did just want to share that our plan is all online, which is very big for us. So if you want to check out our website, it's canceririowa.org. Next slide, please. I'll just spend a minute here, but like I love to get into the nitty gritty of this. So if anybody is really passionate about the kind of background design of cancer plans, Katie and I would love to have a little coffee chat with you. Of course, the best cancer plans and strategic plans involve a variety of partners and members as part of their planning process. So something that worked well for our team in Iowa was not recreating the wheel and actually using what an organization called the National Association of City and County Health Officials, or NACCHO, using their community planning framework. And it's called the Mobilizing for Action Through Planning and Partnerships, or MAP process. It's really neat because it's a community-driven strategic planning process that is commonly used by local public health agencies and hospitals to improve community health and develop their like community health needs assessment and plan. We really liked it because it allowed us to apply strategic thinking to kind of prioritize all those different cancer control issues and figure out ways to address them. I did note in the slide that it's not an agency focused assessment. So it wasn't like, what is our cancer coalition doing? And then in another bucket, what is our state government doing? But it's really focused on the larger landscape of what's happening and taking in both data targets, but also like what you're hearing from the community and what there's momentum around. So I would say we utilized NACHO's framework a bit off-label, but I still think that it works, and I'm still really proud of our work to organize our 2023 to 2027 Iowa Cancer Plan revision process. So on the next slide, we just included a couple screenshots of what you'll find on our website. This is our cancer plan, and big credit to the Wisconsin Cancer Coalition. They went before us in putting their plan online and really helped us out throughout the whole process. But we have our different chapters there listed on the left-hand side. And so our chapter 2 is focused on prevention and risk reduction. And so within that chapter, there's a variety of different priorities, and lucky number 7 focuses on decreasing exposure to radon. We'll go through these a little bit more in depth, but I just want to share like that we as a state are really more than happy to share the wording in our plan or any background about how some of these were created with any other states or partners that want to include this in their cancer plan. The other thing I wanted to mention too is that and I think I referenced it, but just our coalition has really been passionate about radon for a very long time, for like over a decade. And really our plan is a representation of like what our partners and advocates were able to do kind of over these last 10 or 15 years. And that's only, it wouldn't be possible without them. Let's see. So if we want to go to the next slide. We have a variety of different strategies. So that's kind of like the next level underneath radon. And so I was just going to kind of go through, we have 3, A, B, and C. So A is increasing awareness and research around the connection between radon and cancer risk. So I won't read it to you, but just a couple highlights. It has a lot to do with educating the public and policymakers about radon and when to test and mitigate their homes. And really supports that ongoing research into radon and also data collection. Next slide. Strategy B focused on increasing testing and mitigation for radon in homes and other buildings. Some highlights here are really collaborating with cities, housing departments, and other organizations to provide financial assistance or incentives for radon testing and mitigation. Because as you know, if you live in an apartment or maybe don't own your house, you could be living in a home with high radon and not be able to do anything about it. So we really want to make sure that there's equity in place there. And we do have a couple counties that have adopted that sort of legislation. And let's see, policies to require radon testing and mitigation in multi-housing units and rental housing. Next slide. Strategy C is just increasing the number of buildings built or remodeled using radon reducing methods. So Catherine had mentioned just the radon resistant new construction. And then also from a workforce perspective, making sure that our radon testers and mitigators in the state are keeping up with current practices and receiving the best continuing education. All right, next slide. I think Katie, it's back to you.
Yeah, so also in the plan, we have resources listed. So these are the resources that are listed in there related to radon. And also I want to acknowledge too that we work really closely with our radon program here at Iowa HHS, and then also the American Lung Association, of course, and other partners, and they gave input in this area. And then also the plan has data targets. So there's only one for radon that we have. With the data targets, we try to capture something that we are able to monitor and actually get a number for. So if you're actually in the website of the Iowa Cancer Plan, you can hover over these data targets, which is fun. And if there's demographic info, it'll pop up in a little pop-up button, and that's more for our BRFIS data, behavioral risk factor surveillance system data. Usually for this one, there's not demographic info, but just wanted to highlight that they are interactive. So this one data target that we have is to increase the number of cities, counties, and tribes that have local jurisdiction radon-resistant new construction requirements, and the baseline is 19, and our target is 24. And this is something that our radon partners, including the radon program um, person here at Iowa HHS, Randy Lane, they just sort of monitor this, and if they hear of a new policy being adopted, kind of add it to the list that we have of the cities and counties and other local jurisdictions that have adopted that. Okay, next slide. We're going to watch a short video, but before we do, I just want to give some context to this video. So the Iowa Cancer Plan, when they unveiled this new revised cancer plan a couple years ago, they made one video for each chapter. There's 5 chapters of the Iowa Cancer Plan. And since then, there's been a couple of additional videos too. But the prevention-focused video was all about radon, and specifically this public policy that happened to require radon testing in schools. I also just want to mention too, one thing that's been really interesting is since Iowa does have these high cancer rates, we've had a lot of interest, including among state legislators and policymakers, about what can be done to try to lower Iowa's cancer rate. And it's been really neat to see state legislators actually using the Iowa Cancer Plan as a place to come up with proposed legislation. Obviously, I can't lobby, and the consortium also doesn't lobby, but it's been neat to see the cancer plan used as a resource in that way. And specifically, there's actually 2 state legislators currently who have been working really in a bipartisan way. They presented at the Iowa Cancer Consortium's annual Iowa Cancer Summit event, and they've been introducing a lot of bills about radon, but we want to celebrate this public policy win that happened previously. So we can go ahead and start playing the video. Thanks. We can go to the next slide. So that just shows that video. I just also wanted to plug that there's a resource that the Iowa Cancer Registry created, again, digging into Iowa's high cancer rates. And it shows that lung cancer is one of 4 cancers driving Iowa's high and increasing cancer rate. And then this is sort of a screenshot of 2 separate parts of the document. But I just wanted to note how they plug the Iowa Cancer Plan in there, and it specifically talks about radon mitigation strategies in there. So it's just really great how the Iowa Cancer Registry is also helping to raise awareness of the cancer plan. And then next slide. This is another resource that the Iowa Cancer Registry created that refers to radon. This was a Cancer in Iowa Spotlight series that they were doing, and this was the one that they made about lung cancer. And again, the screenshot is sort of showing 2 different sides of it, but they specifically talk about radon in there and getting tested for radon. And they're actually also doing a 99 counties project right now that the Iowa Cancer Consortium is a part of too, and we're a partner of, where they're going to each county in Iowa to talk about the high cancer rates. And for many of our counties, lung cancer is one of them. And when they talk about lung cancer, they talk about smoking and they talk about radon as part of that too. And the next slide, back to Rachel.
Yeah, so just some recommended steps if you are developing a plan in your state, just to give yourself plenty of time. It took us about a year to get through that revision process. You want to make sure to invite the right people to the table. So just ensuring that you're inviting a diverse range of perspectives. Again, like lived experience, proximity to cancer and those sorts of experiences, and be upfront about the different time commitments. Third would be just to look at existing plans. Again, don't recreate the wheel if you don't have to. There's so many great state plans that are out there. And especially, like as Catherine had mentioned, like there's a lot of folks that do have radon in their plans. So feel free to reach out to them to see if you might be able to steal some of their language too. And then, yeah, we didn't talk about it, but we do a lot of like virtual collaborations just because we're a rural state. So using that as much as possible, and obviously making sure that our policies within our cancer plan are as equitable as possible, and just really thinking about all the different ways that radon can impact people and kind of how to reduce those barriers. Next slide. Yeah, so thank you all for listening to Katie and I, and we're happy to take any questions. I don't know if we're doing it at the end. But really appreciate your time.
Thanks, Katie and Rachel. I'll jump in. I believe that we are doing questions there at the end. So my name is Alexis. I'm the nationwide manager for indoor air quality and focusing on a lot of our radon resources and educational initiatives that we have. So today I'll share a little bit more about what those are. You can head to the next slide. Before I get into the resources and initiatives that we have going on, I do want to talk about a healthcare professional indoor air pollutant survey that our team developed and distributed and analyzed over the last few years. Next slide. So the indoor air quality team here surveyed over 1,000 healthcare professionals from across the country to assess their knowledge and their practice in addressing indoor air pollutants with patients. So we were able to analyze responses from 901 healthcare professionals that are currently practicing or have practiced in the last 12 months at the time of the survey. So there's a lot of information on the next few slides. I'll just do a quick summary. We saw a decent spread across various license types, so including physicians, nurses, pharmacists, respiratory therapists, and more. We saw a mix of areas that were served from suburban, urban, rural, and some tribal areas. And then for years in practice, we also saw a good mix of early, mid, and late career providers. So answers from all across the spectrum. Next slide. We then asked respondents whether they agree or disagree with a series of questions that assess their beliefs. So the dark purple over on the left would be strongly disagree, all the way over to the dark blue that you're seeing on the right is strongly agree. A majority of respondents strongly agreed that healthcare professionals do have an active role in discussing indoor air pollution and health with their patients, that healthcare professionals are positioned to help patients understand the impacts of indoor air pollution, and they agreed that assessing exposure to indoor air pollution can be relevant to the care of their patients. So that is all super great. But when we asked them how satisfied they were with their current knowledge of the health effects of indoor air pollution, only 1 in 4 healthcare professionals reported being very or extremely satisfied. And we're looking out the pie charts here at the bottom. And then when they were asked how well prepared they felt in discussing the health impacts of indoor air pollution with patients, the majority of respondents were neutral or disagreed, strongly disagreed. Next slide. And bringing it all together and kind of routing it over here to radon, we also wanted to assess their perceived knowledge around indoor air pollution. So we posed the questions, how familiar are you with indoor air pollutants in general? And how familiar are you with the health effects of indoor air pollutants? And that was for each of these pollutants that are listed on the screen. We listed these out for them. And they were able to answer from extremely familiar to not at all familiar. And if you look at the chart here, we can see that radon was the indoor air pollutant that healthcare professionals felt the least familiar with. Next slide. You can head over to the next slide while I discuss this part. So the responses from that survey really showed us a clear need for enhancing healthcare professional knowledge about radon exposure, about the health risks of radon, as well as their confidence in educating patients about the health risks of radon and being able to talk with them about steps to take to protect their health. So this past National Radon Action Month in January of 2025, the Lung Association focused on addressing this gap. We created resources to help healthcare professionals learn more about radon and be able to talk about testing and mitigation recommendations with their patients. So on the screen here are some screenshots of examples of these resources. They include a decision support tool to help healthcare professionals understand when and how to bring up radon with patients. We also have an educational video presentation on radon in the healthcare setting, a presentation slide deck for educational use, and on our website, along with these resources, you can also find some EPA resources, other handouts, videos, and more. These are all included in a radon reduction toolkit for healthcare professionals that can be found on lung.org/radon. Next slide. So now heading into some of the resources and initiatives that we have in general for a variety of different audiences. We have a handful of resources that are for community members in general. So on the screen are some examples of those. That includes Radon Basics, a free online learning module to help people learn more about radon. A video, Radon and Lung Health, is an educational video that we have in English and in Spanish that talks about radon risks, testing, and mitigation. We have a What is Radon one-pager that's also available in English and Spanish. It's an educational fact sheet that discusses kind of the same risks of radon in a different format. And we do have a new resource, Radon Measurement Guidance for Schools, which is a handout outlining radon testing and mitigation guidance for school administration. These can all be found on our website as well at lung.org/radon. And along with that, we have a ton of different information right on our web pages about tips for conducting an at-home radon test, interpreting radon results, and how to go about getting a radon mitigation system installed if there's a radon problem. On this website too, you can also find links to resources for other professionals such as advocates or decision makers. We have some for real estate professionals, schools, as I mentioned, and also cancer control programs. Next slide. The Lung Association also runs a nationwide test kit distribution program, a test kit store. So we partner with the manufacturer AirCheck to provide consumers with affordable short-term charcoal test kits, as well as long-term Alpha Track test kits. And we do a lot more than just distributing the test kits. We help to track all of the test results. We provide technical assistance and answers to questions. We can help recommend next steps where needed. And we also have been working to conduct follow-up with each person who purchases to make sure that our test kits aren't, they're getting used, they're not getting expired, and that we're actually being able to measure the use across the country. So there are two ways that people can go about getting test kits. The first is that residents can purchase test kits at lung.org/radon-test. And then we also offer discounted bulk test kit orders to organizations, state radon programs, coalitions, health departments, any organization who's interested in distributing radon test kits in their community. So if there are organizations on here today that are interested, you're welcome to reach out to me. And then just some key statistics we have. During the 2024 calendar year, we distributed 9,075 test kits. And so far through May 15th of this calendar year, we've distributed 8,547 test kits. So we are on a good track to surpassing what we've distributed last year. Next slide. Our Lung Helpline, which is a nationwide service that exists for residents across the country to call about lung health questions, lung disease questions. We are utilizing them now to also answer radon questions. So they're able to talk about radon testing, interpreting radon results, or helping someone find a certified radon professional in their area. Next slide. Another initiative that we have is we facilitate awards for the Conference of Radiation Control Program Directors National Radon Poster and Video Contest, and this engages youth in radon education and awareness. So the 2025 contest was judged this past January during National Radon Action Month, and these were the winners. So our first place winner was Adeline Mosley from Colorado. Second place was Alexia Vallo from Oregon. And then third place was Olivia Ryder from Florida. Next slide. The National Video Contest chooses one winner each year, and the winner was Luke Larson, who is actually from Iowa. And I think the video is only about 30 seconds. If you can go ahead and play that, that'd be great. Thank you. So that the radon poster and video contests are run by each state on a statewide level, and that happens at different times throughout the year. So a few states like Iowa, for example, the current contest just ended recently, but other states might do theirs in fall, and then the 2026 contest will happen next winter. So be on the lookout for all of that. Next slide. And then lastly, I wanted to talk about a new program that we have launching this summer. The Clean Air School Challenge is a new program designed to help schools improve indoor air quality and energy management within their school buildings. So the program really meets schools where they are at in their indoor air quality and energy management journeys, whether they already have a plan, they've already started, or it's a brand new concept to them. Participating schools will receive support and guidance as they work their way through 3 program phases, which are assess, plan, and act. And this program really will be a key player in addressing radon reduction in schools, so we are very excited about it. Some stats, according to the Environmental Protection Agency, EPA, a nationwide survey estimates that 1 in 5 schools have at least one schoolroom with a short-term radon level above the action level of 4 picocuries per liter. So the Clean Air School Lunch will really, again, help to just address this in different school districts across the country. So schools who become involved with their program will receive recognition, training, and technical assistance. The program also provides a structured pathway and support for adoption of an energy efficient indoor air quality management plan. And then it's also, again, designed to meet schools where they are. So just reiterating here that whether they have experience in assessing indoor air quality issues or not, this program is will be beneficial for them. And next slide. Oh, seems these were a bit out of order. You can go to the next slide. Thank you. So some benefits of participation. Schools will receive several different benefits for signing up for the Clean Air School Challenge. Much of what we will offer schools is education and training about school-specific indoor air quality challenges and topics, with the aim of building their capacity to address these issues and take steps towards developing that management plan. We will offer technical assistance and provide participating schools with recognition for their efforts. Well, some schools will have the opportunity to work with a peer mentor as well, and everyone will have access to other lung association programs and services, such as the Lung Health Navigators, similar to the Lung Helpline programs I was talking about earlier, that will be integrated into this work as well. And finally, they will have opportunities to participate in learning collaborative cohorts and be able to apply for mini grants. Both of these benefits are for select schools with specific needs, but these mini grants can go, if awarded, towards assistance with radon testing or mitigation. So again, it really will help to work with radon reduction in schools. So if you have questions about CASC specifically or want to get in touch with that, you can visit lung.org/CASC, and there is the contact email on the screen as well. And next slide, and that is also the end of my presentation.
Hey, thank you, Katie and Rachel and Alexis. We can open things up for Q&A. If you haven't had a chance to put your questions in the Q&A box,